As you might understand, CCSI has that expertise to be able to deliver on developing coherent communication strategies that offer and support robust communication programs at national and even regional levels. We are able to work with the federal government, supporting the NCDC, also working with a local partner to be able to fast track and catalyze ongoing work and add value to the risk communications portfolio in being able to adapt messages depending on what the data and the evidence was saying, and at national level, sitting on meetings, coordination meetings, working with other partners and stakeholders that are already working in that space. At subnational level, so CCSI has a diverse group of volunteers that works on existing projects. And who are these volunteers? These are people who are from the communities, known by the community members, and whose reputation has been leveraged on. They've joined the group of frontliners working with the actors at the subnational level to spread the gospel of COVID-19, what you need to do to protect yourself from COVID-19. And this also translates directly to the communities. So at the local government level, at the ward level, in states where CCSI has existing projects, we've leveraged on those volunteers, and they have volunteered their time and their resources to be part of the COVID-19 workforce. Again, just to say, it's not rocket science, but we've been leveraging on evidence, and part of the work that CCSI has actually done and is still doing is to support perception surveys that actually get the opinion and feedback of the different audiences at different times, knowing that in a particular period, the perceptions and the feelings of the audience might change as the phase of the pandemic evolves. So we listen to that evidence that is gathered at different levels, particularly where the impact really matters, which is at the individual level, the community level, and take that feedback based on tools that have been developed by the NCDC and other partners, and feed that into the process of message development and design. I think the first lesson for me is the robustness of the partnership. So in Nigeria, we have partners who are well experienced and who's gathered a lot of expertise in doing work, especially with relation to risk communication. So the most important lesson is to bring all the partners together to the table, map them, know where they work, know what their abilities are, and see how they can work together so that we actually have the best delivery on the long run. The next lesson I've learned is actually to listen to the data. And then you could ask me, data from who? So that's a very tricky question. It could be data from the audience. It could also be data from policy makers. It could also be data from people that are actually generating the myths and misconceptions themselves. But you must let evidence drive the process. The third lesson I'll leave you with is the lesson that we've learned about dealing with myths and misconceptions. So one of the main pillars in the strategy, one of the first five pillars in the strategy, is addressing rumors and misconceptions. And I've learned that when the cloud of rumors gather, then the thunder of stigma strikes. And it could also be the other way around. The campaign that we're doing is actually plugging into the national flagship campaign that has been rolled out by the federal government through the NCDC and partners. And the theme is currently called Take Responsibility. So I'm a Nigerian woman. What should I do as part of my ability to take responsibility? I need to protect myself. I need to protect my loved ones. I need to make sure I wash my hands regularly. I need to make sure that if I'm in public, I wear a face mask if I'm not able to physically distance myself. And as a community leader, what do you need to do? You need to tell your constituencies that they should do the same thing. And the most important thing that they probably need to tell them for a fact is that COVID-19 is real and is a highly contagious disease, and they must protect themselves and their loved ones.